Cervical cancer is the fourth most common type of cancer for women worldwide according to the studies. But it is also one of the most preventable type of cancer. So, women should be aware of the causes, signs and symptoms of cervical cancer to prevent or diagnose it as early as possible. Today, I will talk about the things you should know about cervical cancer. So first of all, what is cervical cancer? It is cancer occurring in the cervix, a narrow opening into the uterus from the vagina of the female reproductive system. So, let's see what are the causes or risk factors of cervical cancer. Number 1. Human papillomavirus HPV. It is the most common cause of cervical cancer. It is a sexually transmitted virus. HPV type 16 and 18 are high-risk types among more than 100 different types of HPV. It is a form of virus that causes skin warts, genital warts, and other skin abnormalities, and it leads to changes in cervical cells causing cancer. Number 2. Multiple sexual partners. Number 3. Having a male partner who has or had sexual contact with multiple sexual partners. Number 4. Having sex at an early age. Number 5. Women having sexually transmitted diseases like HIV, AIDS, herpes, warts, syphilis, gonorrhea, etc. Number 6. Weak immune system by other health problems. Number 7. Taking combined oral contraceptive pills for more than 5 years. Number 8. Cigarette smoking. Number 9. Low socioeconomic status. Number 10. Mother of many children, which is also known as multiparity. So, these are the risk factors that raise the chance of suffering cervical cancer. These are some symptoms which shows you are suffering from cervical cancer. Cancer in early stages of precancerous cervical cells may not show any obvious signs and symptoms until it progresses to a dangerous stage. According to this silent nature of cancer, regular screening and tests should be done if you have one of the risks causing it. Common symptoms of advanced disease may include bleeding between menstruations or periods, bleeding in postmenopausal women, bleeding and discomfort after sexual intercourse, heavy vaginal discharge with a thick and strong odor, vaginal discharge tinged or mixed with a small amount of blood, pelvic pain unrelated to the menstrual cycle, pain during urination, frequency and urgency of urination if cancer cells spread to your bladder. Okay, but you don't need to be nervous if you have one of these symptoms. These symptoms could also occur in other types of diseases, so you should consult with your gynecologist or doctors if you have experienced any of the above symptoms. Most women ask, can cervical cancer be prevented? Yes, it can be prevented. Here's how you can prevent cervical cancer. Routine pap smear test and HPV test. As HPV, sexually transmitted virus, is the most common cause of cervix, sexually active women are at high risk. If you are sexually active, you should do regular HPV test and pap smear at the hospital or clinic because screening is the only way for recognizing cancer early and timely. Pap test. Your gynecologist will take the sample of cells from your cervix and then look for the cells that could become cancer. Recommended age and frequency for pap smear tests include recommended target age between 35 to 45 years, 3-yearly screening for age between 25 to 49 years, 5-yearly for age of over 50 years, unnecessary after the age of 65 years if the last two tests are negative. HPV test. HPV test in combination with the pap test is used as a way of confirmation or early detection of cervical cancer. It can be tested for women over 30 years of age. HPV vaccination. The ideal time for HPV vaccination is before the age of sexually active. So, It's most effective for children of 11 or 12 years old. It can also be applied to adult girls until they are 26 if they are not sexually active. The vaccine can be prevented mainly from HPV type 16 and 18. It's easily available at hospitals and clinics nowadays. Safe sex. You can reduce the risk of cervical cancer by using condom, having fewer sexual partners, and delaying first intercourse. It can also prevent you from sexually transmitted virus and diseases. Prevention and treatment of pre-existing sexually transmitted diseases. Cessation of smoking. Not using birth control pills for a long time. Eat lots of fruits and vegetables and stay healthy. Here are some treatments of cervical cancer. If you have cervical cancer, you must consult with your doctor first and then receive appropriate treatment timely. Treatments may vary from many factors such as age of the patient, stage of cancer, and other health problems. Generally, cervical cancer be classified into 4 stages. I won't explain in detail about these stages, as I don't think many of you will be interested to read these stages. But if you're interested, hit me up through my email or in comment section, and I will reply you how these stages are classified. According to the stage of cancer, the following treatments can be received. Surgery. Early stage cervical cancer is typically treated with surgery by removing cervix and uterus and or part of the vagina and lymph nodes in the area. Radiotherapy. It can be done alone or with chemotherapy before or after surgery to kill the cancer cells by using high-powered energy beams. It is also indicated for all stages of the cervix, the patient who are unfit for surgery, and recurrence after surgery. Chemotherapy. It uses medications and is usually injected into the vein to kill the cancer cells. It's used in combination with radiotherapy. It can also be used as palliative treatment. Palliative treatment is used in advanced cancer where the cancer is not curable. It is used to control cancer so that it won't get worse. Follow-up. The most important thing to do after treatment of cervical cancer is that you must go and see your doctor for a follow-up. The doctor will recommend regular checkup, usually 3 monthly in first year, 6 monthly for next 2 years, and then yearly afterward. In summary, cervical cancer tends to occur during midlife and it is most frequently diagnosed in women between the age of 35 to 45. It rarely occurs in women under 20. As it is preventable cancer in women, you don't need to worry much about that. All you have to do is to receive the vaccine or regular screening test and to avoid risk factors causing cervical cancer. If it happens, you should get the timely treatment without delay by noticing the signs and symptoms of cervical cancer. Thank you for watching the video until the end. Hope this video will help you in some way. If you want me to cover any other health related topics, feel free to ask me in the comments below or directly through my email. Have a nice day. Peace out.